Hello, everyone. Thank you for tuning in to the Lewis Center interview series. Today is May 11th of 2023, and we have as our special guest Dr. David Vequist IV, founder and director of the University of the Incarnate Word Center for Medical Tourism Research. Dr. Vequist is also professor of management in UIW's HEB School of Business and Administration, an active member of the Liza and Jack Lewis Center of the Americas Faculty Network, and a managing editor for the Journal of Healthcare Management Standards. Before joining UIW, Dr. Vequist was an executive for the Methodist Healthcare System and a consultant for Ernst & Young. He is an accomplished speaker, author, and researcher, and has been interviewed and featured in numerous media on 5 continents, including the New York Times and USA Today. His focus on international healthcare has exposed him to diverse perspectives on health and wellness and shaped his approach in the classroom and the content of his courses. Specifically in Latin America, Dr. Vequist has presented at conferences in the Dominican Republic, Mexico, Cuba, Colombia, Guatemala, and Panama. His cross-border experience is translated into a broader worldview and appreciation of how globalization has impacted health systems over the last few decades. The focus of today's interview will be medical tourism, and we'll start by focusing a bit more generally on the global phenomenon, then zeroing in on its manifestation in Latin America and Dr. Vequist's collaborations with Mexican government officials and healthcare providers. David, it's been a pleasure working with you over the last couple of years, and great to have you here today. Thank you for dedicating time to the Lewis Center interview series. And I want to get our conversation started by asking you to help us understand what exactly is medical tourism.
Thank you. It's a pleasure to be here. Medical tourism, it's also called around the world medical travel or even health and wellness travel or tourism, is typically a byproduct of growing healthcare consumerism, which patients are experiencing all over the world. People are increasingly trying to treat healthcare, if you will, like almost every other purchase that they make, whether it's a product or service. So think of a local business that perhaps sells Japanese cars or French wines. So it's being treated very similarly. Because there's increasing amounts of health information available, particularly on the internet, people are finding that there's more options, there's more reasons for them to potentially look around and see if there's another way to receive the healthcare that they want and get it at the price and the quality that they're really seeking. So the couple of things that I'd like to get through too as well is that medical tourism is not just international. A lot of medical tourism, in fact, arguably more medical tourism occurs domestically, in other words, within country. But obviously, the more interesting aspect is people traveling outside of the country. Within in-country domestic medical tourism, a lot of that is going on because of, again, people seeking better health, better price, better quality within the country, and they're looking outside of their city, their county, or their state. When it comes to traveling outside of country, international medical tourism, what's interesting about this is that it's basically tends to align with existing trade and tourism activities that already occur between two countries' populations. And also from a diplomatic perspective, it's a good thing because typically these populations that are engaging in commerce are less likely to be hostile to each other or to have negative beliefs about each other. The medical tourism that we study includes a variety or a continuum of health-seeking behaviors. We also look at things like death tourism, which is people seeking doctor-assisted suicide, which is legal in certain jurisdictions. Retirement tourism, people retiring in other destinations, typically for lower overall cost or better quality of life. And of course, dental and pharmacy tourism, people seeking those procedures, typically outside of their home region. Overall, it appears to be an intersection of globalization and technology, and ultimately it's impacting healthcare in I think, very good ways because it's creating more options for consumers.
Great, David, and thanks for pointing this out about the the intra-country medical tourism, which I think is also really fascinating. But let's focus now on the international piece. You know, people crossing borders to seek medical care, and tell us about medical tourism specifically in the Americas. And what are some of the most important directions of mobility from one country to another? Where are people coming from and where are people going to?
So this has changed quite a bit based on the pandemic and also recent geopolitical events. So a lot of this is still evolving. But let's first talk about the United States. Obviously, many people are aware that people leave the US, but not as many people are aware that typically the US has in past years been a net receiver of medical tourists. So we see a lot of medical tourists coming into the country from across the world, particularly in the past, places like China and the Middle East, and also wealthy populations from Latin America coming into the United States and paying for the quality of care that they receive here. However, of course, as we've seen, recent changes in policies and feelings and beliefs about certain countries, geopolitical events, and other things that are going on have decreased some of these flows, particularly when it comes to inbound flows into the United States. So, in terms of a balance of trade, what we're kind of expecting in the near future is, quite frankly, more outbound Americans traveling abroad rather than foreign nationals, particularly, say, the Chinese coming into the United States. This is also being driven in many ways by some of the policies that are going on right now, inflation and supply chain issues. So what we're seeing is ultimately that there are more opportunities for people to travel internationally for healthcare. We expect Americans are going to take advantage of that.
Interesting.
Interestingly, Canada. Canada's a very strange combination in that the residents seem fairly happy with the healthcare schemes that they have in place, but they also have extremely long wait times. So overall, Canada is a net sender of medical tourists, and we see Canadians in the United States, particularly in the north and northeast, quite frequently. And also you see them in other places, for example, in Latin America, receiving care. I remember seeing Canadians, for example, in Cuba, receiving various types of care there. So again, Canada doesn't tend to receive many medical tourists into the country, but they do tend to send more than their fair share out. Now, again, the most interesting of all, most fascinating, and probably the fastest growing area is Latin America. So there's some very special aspects of medical travel in Latin America. First of all, we have increasing affluence, particularly in some areas, for example, South America. And so what that's allowing is for residents of these countries to be able to have more money so that they can travel for higher quality care in places like the United States. And we see increasing numbers of people from these countries in the US. However, we also see, again, greater number of Americans traveling into countries in Latin America, particularly Mexico, but also including countries like Colombia and Costa Rica and the Dominican Republic and many others. And we expect that that's going to continue in the future.
David, that talking about the Americans going to Latin America reminds me of one of the recent short pieces I read that you wrote on the relationship between immigration and medical tourism. I know there seems to be a correlation between one and the other. Tell us a little bit about your findings.
Yeah, it's not only a finding that we have here in the Americas, but we're finding in many other places around the world. Definitely, when we see immigration increase, which we're seeing significant increases in immigration into the United States right now, we do see also increasing amounts of medical travel. So obviously, one of the major factors for people traveling for any reason, particularly tourism, but also for medical tourism, is a familiarity with the location that they're going, particularly with the language and the culture. And also, if you have some family history or ancestry from that region, that also increases the likelihood that you're going to go to a destination. In several studies, both in the United States and Europe and Asia, we found that upwards of about 20% of immigrants, recent immigrants, are likely to travel outside that country that they arrived at for some health care elsewhere. And multiple studies, particularly a recent study that was done by the CDC, show that Hispanics and Asians in the United States are up to 3 or 4 times more likely to travel abroad for healthcare than other Americans. In addition, one of the things that we find is typically where the immigrants are coming into the country, for example, in the southern border, for example, places like Texas, what happens is when they arrive at these final destinations, oftentimes the healthcare infrastructure has not been properly built up to receive these immigrants. So then we have issues with accessibility of healthcare. Lastly, there also is this really fascinating thing that's been coming up in the literature for nearly a decade, which is called the healthy immigrant paradox. So, what we see is typically young, healthy residents from other countries that immigrate into, for example, a more highly economic developed country that has more health infrastructure. And typically those residents have higher life expectancy. However, these immigrants' health status typically changes, oftentimes for the worse, when they come into this new country. And so, for example, we've seen that with Mexican immigrants and other Latin American immigrants coming into the United States, having initially worse outcomes. A couple reasons for that, including the lack of communication from previous providers to new providers, language issues, and things of that nature. But it's a really fascinating issue that we continue to see. And one last point that I'd like to make is we do see that interestingly enough, although we have this healthy immigrant paradox, again, it becomes more of a paradox because overall, when we look at population health statistics, whether it's immigrants coming from a place like Japan or Europe or even Latin America, when they do arrive in the United States, we do see that they have longer life expectancy in the United States than they would have in their home countries. So overall, it appears that immigration does provide people with a better quality of life.
Thank you, David. There are so many trends and patterns we could look at, and let's talk about one of the, maybe one of the most obvious and general patterns is just growth of medical tourism. Do you see medical tourism continuing to grow in the future?
Oh, yes, very much so. There's so many factors that point to, if you will, a combination of things, a perfect storm, if you will, that is going to perhaps increase medical tourism significantly in the near future. So let's use, for example, the United States as a specific case study. So in the US, we have increasing amounts of healthcare medical tourism going outside the US, predominantly to countries like Mexico. And it's been growing at over a 10% rate for many years now. So what's happening? Why is this happening from the United States, which has, if you will, fairly adequate healthcare infrastructure? Well, one of the big things that we see is declining number of providers as a ratio, providers being like doctors and nurses, as a ratio to the population. This is particularly acute in the United States and also other very large developed Western economies, is that the populations for most of these economies are slowing. In the United States, we have a fairly decent repopulation rate. And we actually have significant amounts of immigration. So our population is growing faster than we are able to create new providers. In other words, graduate new doctors and nurses. Therefore, we have basically a supply and demand issue and also ultimately capacity problem. So another aspect of this, as we talked about before with immigration, we're seeing the significant growth in places like Texas, for example, and Florida, specifically in places like Texas, the Rio Grande Valley, which has a very fast growing population, fairly young population, and the healthcare infrastructure is not built up for them. So again, they're basically coming to places. The populations are growing in places that don't have sufficient capacity. Then we also have another controversial issue, which is, in fact, two of them back to back, which is an increasing obesity problem in the United States, which most people are aware of, and unfortunately is a factor that affects many minority populations, particularly Hispanics, more than others. And so this increases the overall need for healthcare and also increases the amount of chronic disease in the population. So that is creating additional issues on the healthcare system. And then among young people, particularly millennials and Gen Z, we've seen significant increases in mental health issues. These tend to be a strong comorbidity factor for other physical issues as well, which also, again, as you can imagine, increases the propensity or prevalence of other health issues. So overall, what we have is basically a population that's growing, lower provider ratios, more chronic health conditions, more and higher rates of mental health, which also affect physical health, and growing utilization. Interestingly, I didn't mention this before, but millennials and Gen Z at this point in time, compared to previous generations, are utilizing healthcare more. Now, that typically would be a good thing, but with lack of providers, perhaps lack of capacity and access, it isn't proving to be a good mix. So the relief valve for all of this, for all these factors combined, may be at least partially medical tourism and, if you will, outsourcing of healthcare services to countries like Mexico. So ultimately, this is kind of a way in which people are taking control of the situation that they're in and trying to find healthcare at the price they want, at the quality that they want, and what they can afford.
That's great. That all seems very good, David. But what about the risks? What about the risks for travelers, particularly travelers from the U.S. traveling to Mexico? The dangers that U.S. medical tourists face when traveling to Mexico are often the focus of the U.S. media's attention to medical tourism. Recently, of course, much attention was given, and rightly so, to the tragic murders of U.S. citizens who had innocently traveled to the state of Tamaulipas to seek care. And of course, there are the stories that we've heard over the years about the unsuccessful medical outcomes for certain families and individuals. Could you put this bad news into context for us a bit?
Yes. First of all, I want to say that the prayers of myself and the center and the university go out to the victims and their families of the recent tragic events in Mexico. This is a question we get asked quite frequently at the center, and is recently in articles with the New York Times, interviews with CNN and the Washington Post, is this safe? Is this a safe activity? And so I have to give a kind of a mixed answer here. Quite frankly, there's not enough data to show that there is overall much difference in healthcare outcomes that occur for medical tourists that are going abroad. For example, an American going into Latin America compared to the outcomes that they get in the United States. We do have some limited data, and that data paints a mixed picture. For example, some CDC researchers did a very good study with a very large population sample size in 2016 that they reported in 2022. And what they found was overall a self-reported, which is not the best measure, but a self-reported complication rate from medical tourists at about 5%. This compares to what we see in the United States, which is anywhere from, say, 4 to 7%. So quite frankly, the data is not necessarily supporting that there is more clinical risk with traveling abroad for healthcare, although it is known in the literature that traveling, particularly large distances, can potentially expose you to, for example, bacteria or viruses that your body is not as comfortable with. And so that can increase your infection rates and things of that nature. But overall, we don't see many problems. Now, when it comes to safety and security, this is an issue if you travel anywhere, whether it's in the United States or outside the United States. And obviously, the consumers need to be careful about where they're traveling to. And for example, the State Department has very specific recommendations and guidance for people about where to travel. So, for example, in Mexico, they actually do it within different regions or different cities. One other thing that I'd like to point out, I think this is really fascinating, and this speaks to the cross-border nature of policies and of trade and commerce. Several years back, in fact, actually, it's been more than a decade now, the Mexican government decided that they wanted to make a commitment to higher quality care for their facilities. And so what they did is they reached out to the American accreditation organization, which is called Joint Commission. And so what they did is they purchased or licensed the content from this accreditation system, and they integrated it into Mexico. This is not well known in the United States, but actually thousands of Mexican healthcare systems and clinics are actually using standards that are very similar to the United States. So arguably, this would actually create a network, a system, if you will, of quality within Mexico that's very similar to what's found in the United States. So if we look all this combined, yes, there is safety and security issues. Buyers should definitely beware when making decisions, and the more information and the more accurate the information they use, better decisions they'll make. But overall, in terms of traveling, in terms of the clinical outcomes, we don't have enough information to say that this is more dangerous or significantly more dangerous than travel and healthcare in the United States.
Interesting. David, that's a really good balanced answer and helps us understand the complex reality of medical tourism. Now, your view is very balanced, but overall, I know you believe in the overall value of medical tourism, and I congratulate you for taking that and then moving on with that. That informs your work, and you're doing work to inform the public and help foster what we could say is the proper development of this massive global phenomenon. And along these lines, I have one final question about the work you're doing with Mexico's Secretaría de Turismo, David.
Right. Well, thank you for asking about that. So we're a big fan of the idea of this cooperation competition model that was originally developed by Dr. Michael Porter from Harvard Business School. And the idea is clusters. Clusters tend to create opportunities for engagement, not only within a region, but also the ability to bring together assets and resources that allow them to serve the needs of their patients better. And so we've seen clusters in a variety of industries. In the healthcare industry, it's relatively new, but it's still been a growing phenomenon. Most prominently in medical tourism and health tourism, health travel around the world, we see that most of the major destinations, whether it's Korea or Turkey or Malaysia or Colombia or these places, tend to have vibrant health clusters. In fact, here in the United States, we have one of the most, if you will, significant and impressive health clusters in the world in the Texas Medical Center in Houston. That medical cluster is well known around the world, and we see both knowledge sharing, human capital development, and a focus on the economic impacts to the community and developing better infrastructure. So we've been looking into this health cluster model and recently have uncovered some data that shows that where there is an increase in medical tourists going to countries like Colombia, we've also seen an increase in infrastructure development. In other words, what happens is as people start to work together, as international patients go into that area, there is an overall growth in healthcare infrastructure, which benefits not only the international patients, but the domestic patients. In other words, people in Colombia are gaining access to better healthcare. So what we did is approached the Mexican federal government with this idea of the clusters, and they were already working on this, although it was a very kind of fractured system where some clusters were doing better than others. And so they wanted to help to promote these clusters. They wanted help to develop these clusters and to really make them work better for those regions. So we've been doing a training program for several months now with clusters throughout most of the Mexican states and cities, and basically helping them to work on both cooperation and collaboration in a cluster format. Ultimately, we hope that this will lead to better healthcare, not only for foreign patients, say Americans going into Mexico, but it's going to lead to better healthcare infrastructure, better systems, and better processes, which will benefit Mexicans. It'll benefit the Mexican economy, which as a resident of the United States here in Texas and a neighbor of Mexico, that's going to be good for everyone. So it truly is a win-win-win. And we're hoping that our efforts will provide a very good return for Mexico and the people of Mexico in the near future.
David, I love the collaboration for so many reasons. Of course, as director of the Center of the Americas, the cross-border work, working with other nations to tackle the great problems of our world's global society. That's what we care most about, and you're doing that kind of work now with this collaboration, and I congratulate you for that, and for all the work that you're doing at the Center for Medical Tourism Research. I hope we can do this again. This is, we tackled one particular area of your work, but we have much more to discuss. So thank you for being here with us today, David, and I look forward to our continued work together and to having you back for the Lewis Center interview series. Thank you.
Thank you, and I appreciate you having me.
You're welcome.